To learn more if you're a candidate for medical cannabis, consult St. Kaneh-Bosem Consulting. Set up an appointment. Check out our website at 420nurse.org.
It should come as no surprise that across the nation 58% of Americans, 55 and older, now admit that smoking pot is morally acceptable. This is according to a 2018 Gallup poll. The number of older Americans using cannabis is getting higher according to an article by Rachel Nania, published in AARP in February of 2020. Nania takes her source from the journal JAMA Internal Medicine, which revealed that cannabis use in adults 65 and older increased by 75% over a 3-year period. Among the 65-plus population, 4.2% used cannabis in 2018 versus 2.4% in 2015. The report, which analyzed data from the National Survey on Drug Use and Health, found that the number of adults 65-plus with chronic diseases who used cannabis increased overall during the 3-year period. The biggest jump, 180%, was among older adults with diabetes, which geriatrician Benjamin Hahn, assistant professor of geriatric medicine and palliative care at the NYU Grossman School of Medicine, speculates may be due to studies suggesting cannabis could help ease nerve pain from neuropathy, a common negative result associated with type 1 and type 2 diabetes. Other noteworthy findings indicated that cannabis use increased 93% among women 65 and older during the 3-year window, and nearly 114% in older adults with a college education. Married adults and those with higher incomes also experienced spikes in cannabis use, as did racial and ethnic minorities. Older Americans using cannabis aren't what you typically think of when you picture someone using marijuana. Senior citizens and elderly patients with chronic conditions across the country now have more access than ever to the healing properties of cannabis, and they're taking advantage of it. Truth be told, elderly patients and senior citizens will experience the same benefits other users do when taking medicinal cannabis. In fact, many of the primary conditions, symptoms, and side effects that cannabis treats can be associated with the aging process, such as chronic pain in the muscles or joints, inflammation of the muscles or skin, lack of energy to perform daily activities, decreased or lack of appetite, attention issues, anxiety and depression, and the list goes on. For decades, marijuana growers, sellers, and consumers have classified the strains as indica or sativa to explain the type of effect they would have when consumed. But what's the difference? Physically, yes. These terms were originally created to help botanists classify plants on the basis of physical characteristics. That does not directly translate into the distinct effects those strains have on the human body, however. So the question remains, what about which strain to use? And how do I determine what's best for me? Sativas have been known for their head high, an invigorating and energizing effect that can help reduce anxiety or stress, and increase creativity and focus. And indica strains are typically associated with full body effects such as increasing deep relaxation and reducing insomnia. And then there are the hybrid strains. The hybrid strains have become as prominent as indicas and sativas, if not more so, toting the blending of legendary aspects of both sativa and indica. While hybrids certainly present a more nuanced taxonomic reality, They do not provide a label that adequately indicates the effects that a user can expect from a cultivar. This is especially true as we recognize how differently our individual bodies react to cannabis. But this untruth about strains and their differences is based on decades of misinformation. Fact is that this classification system was faulty to begin with in regards to describing the effects of the strains. And through the advent of molecular testing, it has been proved that there is no reason in splitting them up into either hybrid, indica, or sativa categories in the end. The approach to the desired effects that you can experience from cannabis strains are much more directly tied to cannabinoids and terpenes than to a particular strain. Now knowledge comes through experience. Everyone's body reacts differently to the external influences encountered. All it takes is experience and the right information to know what will work for you. Ultimately, you are your own best resource for determining which cannabis products will deliver the effects you are seeking. The bottom line is that hybrid, indica, and sativa may be useful adjectives to describe certain sets of effects when advertising. But don't count on those products with these labels to consistently deliver those reported effects. Christine A. Dewar-Becker, B.S. RPH has compiled a guide for seniors regarding cannabis strains. Medical cannabis may be effective at reducing chronic nerve pain, including neuropathies, from a number of various conditions. She indicates that the best strains for seniors and daytime pain relief include Lemon G. 1:1. Ideal because it has both THC for analgesia, pain relief, and CBD for inflammation. Another is Durban, high in the terpene terpinolene. Durban gives a functional uplifting effect. And Harlequin. It has a higher CBD option for anti-inflammation, and is noted for being clear-headed. A good night's sleep is essential for both physical and mental health. Dewar-Becker further identifies that the best strains for a senior's good night's sleep and pain relief are BioJesus, which is high in myrcene, another terpene that provides pain relief and relaxation. Blueberry Space Cake also has myrcene and is great for pain relief and relaxation. And Afghani, which is also particularly high in myrcene, is great for pain relief and relaxation. Dewar-Becker also indicates that if you're looking for a cannabis treatment that is minimal THC, the major psychoactive cannabinoid in cannabis, then you'll want to learn more about CBD in general, as these strains are great for daytime treatments that bring relief to pain and inflammation without psychoactivity. Strains high in CBD can be in the forms of smokables, ingestibles, and topicals. Dewar-Becker shares some favorable strains high in CBD for being very clear-headed, as well as the benefits of supported anti-inflammatory effects. These include the brand Solivo 50:1, a CBD to THC tincture, the brand Ease 1:10, a THC to CBD tincture, as well as the brand Standard Farms 10:1, a CBD to THC tincture. St. Kaneh-Bosem Consulting PLLC has two other picks as well. The brand Straight Hemp CBD Oil, a full-spectrum CBD supplement that contains less than 0.3% THC, and the brand Irwin Natural CBD, a full-spectrum encapsulated CBD oil that contains less than 0.3% THC. If you're confused about what may work best for you, consider the consultation of a medical cannabis nurse educator, like Christopher Bashaw, RN, based out of Dover, New Hampshire, who can help you understand the myths versus the science behind medical cannabis. To learn more, check us out at 420nurse.org. Again, that's 420nurse.org. This has been an educational in-service provided by St. Kaneh-Bosem Consulting PLLC.